Hello, it's Megan, your MO with Island Manual Osteopathic Therapies. I wanted to discuss range of motion in the hips, how to tell if a muscle group is restricted or lax, what that even means. Often we'll go through the range of motion in the pelvis, both legs, usually to address knee, hip, back, lots of different areas that are affected when one part of the body is restricted and the other side might be weak, or vice versa. So in an appointment, you'll see if we wanted to assess the hamstrings, for example. The hamstrings, the back of the muscle, three hamstrings that make up the muscles there. So all we're doing is checking to see if that leg goes straight up. We're looking to see if the knee doesn't bend. It just goes straight up like that, at least about 110 degrees, 120 degrees. So something like this. Straight up and down is excellent. Anything more is too far. So if someone was going way over here, I would say that's very lax. Definitely would not encourage continuously pulling that even further for the purposes of range of motion and healthy range of motion. So we want to see that it's got good, healthy integrity. There's a little bit of rebound there, and if the hamstring only goes here, we would want to do some stretching. So stretching could literally look like holding it into a stretched position. Another way to stretch it would be a somatic technique. I'll demonstrate that when I turn over to show the range of motion assessment again, what we did for the quads. For now, we would just check out both sides. We want to make sure it's even. So again, making sure that that's a healthy range of motion there. One other thing is, without it being straight up and down, but in a comfortable length, relaxed knee, I'm looking to see if the calf is tight. So if the toes come towards the body into dorsiflexion this way, is it a decent amount of range of motion, or does it barely move? What's going on there? And of course, there would be different stretches for that. Checking both sides, of course, looking to see how the range of motion is there. Other things we check for is lateral rotation, medial rotation. And so this would be a straight leg. I want to see that it moves about 30 degrees into medial rotation, a bit further into lateral rotation. So those are pretty good ranges of motion there. Another example would be to go into adduction. Add to the body is a good way to remember that, versus abduction. So we give the ankle about 30 degrees range external rotation, and we just bring the leg away from the body. And if there's compensation or restriction in the inner leg, then we know it's restricted. Psoas, you're going to hear psoas so much regarding the lower back. Why? Because it's attached to the back, the vertebrae, but on the front part. So the psoas attaches from L1 down L3, 2, or so, all the way down L2, 3, 4, 5 to the sacrum. Oh, that's not correct. To the femur. And so its actions are hip flexion. You've probably heard hip flexors. It's one of the hip flexor groups. It's also for medial rotation as well as adduction in the hip. And so to assess if the psoas is restricted or not, you bring the foot to the opposite knee, and then you allow that knee to relax out to the side. If that knee is sitting quite a bit higher than the knee on the ground, like in my case right now, it's quite a bit higher. And so a really good technique we could do is just like this. We want to have that knee relaxed. And so if it's not the case where it's relaxed, we would make sure we have a pillow close by so that we can relax that knee. We want it to be completely in a good, comfortable position. And then we're going to work on contracting that muscle. So first, I'm just going to bring it inwards as slow as I can. I go where I comfortably go, pause, and I want to keep my awareness into what's lengthening. I'm imagining a slow lengthening of the psoas. Its attachment site at the proximal femur is going farther than its origin from L1 to L5. When you find neutral, this is important to let that knee relax. Let it fully rest here. And we're going to repeat that 1 to 3 times, as slow as humanly possible. We're going to contract that psoas, which means we're shortening that muscle first, going only to where that knee comfortably goes. Keep that awareness of that shortened muscle now lengthening as you slowly lower the knee. When you find neutral, just rest. So you can repeat that 1 to 3 times. Maybe even this next time, you might be able to have the pillow away from the body. Maybe the pillow needs to stay there. Just go with what your body is feeling day by day. You might notice it changes. When you find neutral, be sure to rest. Good, so that's one example of the psoas. That was going into medial rotation first, followed by elongation. Another way to do the same thing, you can have your knees bent or your legs straight. Either way is fine. I'm going to start with knees bent here, just so that people starting out with this video can go into what is probably the easiest route. It would get harder with a longer leg, but we're envisioning the spots of that muscle. Now we're going to slowly bring our hip into hip flexion as slow as we can. You might notice some shaking. That's what we're clearing. That signal from the mind to the body. It's not a smooth signal if there's shakes, if there's bumps and jolts. When we've gone to where we comfortably go, keep the awareness in that muscle. Now imagine it lengthening as slow as you can. Lowering the foot, lengthening the front of the left leg and abdomen. Hips slowly going away from the belly button. When the foot is rested, let the whole body rest. Of course, you repeat that on the other side, so I'm going to go through that quite quickly, but assessing if that knee is higher than the other knee by 3 or 4 inches, then it's indicated that the psoas is restricted. If it's quite jolty, it's quite unstable, another indication that we should try a somatic technique to strengthen the neurovascular connection. Somatics gets into the motor cortex part of the brain. We slowly, medially rotate, only going where we comfortably go. Keep the awareness in the inner leg and abdomen, noticing it lengthen as you lower your right knee. When your knee is rested, ensure the whole body relaxes. And so as hip flexion, as slow as you can, bringing the knee towards the chest. Only going to where you comfortably go and pausing, keeping the awareness in the front of the abdomen and the front of the right thigh. Notice it lengthen as you lower the foot. When the foot is rested, let the whole body relax. Repeating that 1 to 3 times as slow and smooth as you can. Keeping the awareness in the front of the body. Noticing it lengthen as you slowly, smoothly lower the foot. When the foot is rested, relax the body. Cool, so that's psoas there. So if medial rotation was restricted or if lateral rotation was restricted, an easy way to do those ones would be on the side body. So as if you're on a chair, your knees come straight up. Make sure you can see your toes poke through at the bottom. If it was restricted in medial rotation, meaning it was more like lateral rotation, then you just do what you comfortably can, lifting the knee first. That's contraction. What did you contract? Well, the posterior aspect of your right side of the body if you're laying on your left side like me. Awareness here as you start to lower your knee, lengthening the left side of your body. When the knee is rested, let the whole body relax. So again, you would practice that 3 times, 1 to 3 times, doing it as slow and mindful as you can. 3 steps is shortening, lengthening, rest. This would be to enhance medial rotation here, lifting the foot, but mostly feeling the hip elevate and medial rotation of that hip. Awareness in the contraction, this side of your body, as you start to lower the foot. Notice this lengthening. And resting. Another reason that the back might be sore could be the quadratus lumborum, which is a muscle in the back. It's a very deep stomach muscle, but it attaches to the PSIS to the lower ribs. That is PSIS, it might actually be on the ilium. My apologies, I don't remember the exact spot, but anyway, it's from here to the lower ribs up here, and its actions are hip elevation, so elevating the hip. It's a great one to do if you're on your side, and so you could do it standing. Of course, you could do it really slowly up, slowly down, rest, slowly up, slowly down, rest, even slower than what I demonstrated, like as slow as you can. So if it was this side, you might do this on the edge of a bed or something, because then your leg has some room to grow, but you're just really slowly lifting from here, not lifting the foot, but lifting here, and then as slowly as you can, lowering and resting. And doing that 1 to 3 times each side, being mindful of what's contracting and mindful of what's lengthening, and making sure to rest. Demonstrate on the other side. Again, do this as slow as you humanly can. Lateral rotation, slowly lowering and resting. Hip elevation. I skipped medial rotation, I realize. But you get the point. So you can make your own routine here. It doesn't have to be in order, it just has to be slow. When you're elevating the foot, you're noticing the hip is elevating. Medial rotation of that foot, even a little bit. Lowering, and then resting. So again, we have the assessment to check if the quads were tight. Another thing we can do here is to check if the hip extension has a healthy range of motion, so if that knee lifts up. And not only that, if we can hold that knee up, it's a good sign of glute health. It's a good strength if you can push down on the foot even. I'm checking to see if the glutes are evenly strong or if there's some differences. So lifting the knee up, only comfortably, of course. Like, don't wince, don't cringe. You shouldn't be trying anything. You should just be going to what comfortably is, noticing it, and then letting it go. So we can make a somatic out of all of this. We could slowly lift, we could slowly lower, and we could rest. We could slowly lift, slowly lower, and rest. I always love somatics instead of isometric, isotonic contractions, because the reps is way lower. Like 3 is just really speaks to me versus 7 times 3. I like that better. I mean, it's okay that it's really slow. It's actually very helpful. So the range of motion assessment is also the treatment. So if we're assessing the quads, we could also treat the hamstrings here. So we would really, really slowly contract, and actually my hamstring here seems to be jumping quite a bit. So it's not a smooth ride, and I just notice it. I don't change it. I go to where it comfortably goes, keep my awareness in the back of the leg, because that's what I'm lengthening as I slowly lower the foot. When the foot is rested, let everything relax. You can be even more relaxed and doing the same thing on the other side. And in neutral, just rest. What did I miss for low back? If you haven't yet, check out the inspiration, expiration videos. That's just enhancing what naturally happens when you breathe in and breathe out. And then just learning to actually nudge the sacrum each way. So if you were inhaling, you're kind of tipping the tailbone down and letting that go. Doing that 3 times. If you're exhaling, you'll notice it actually curls up on the exhalation, letting it go. Repeating that 1 to 3 times. That can really help with a lot of low back pain. So a lot of this is geared towards hip low back pain. If we actually start to get strength awareness in these individual bones, there's 1, 2, 3 bones here, we start to get better control of everything. This sacrum moves individually of these ilium and vice versa. We can actually roll this medially. It can roll inwards just as well as it can roll outwards. So that will be very, very hard to do, especially in someone who hasn't done this as part of their mobility work. So a lot of times we will see one person's hip is stuck one direction or the other. We go on a line and we just see what naturally is. I typically have a deep sulcus of my left hand side, so it means my hips are kind of shifted right often. But I can move these individually. I can elevate the hip and I can depress the hip. When this elevates, this depresses, and vice versa. These hips here, it's best felt if you're going inwards medially, this hip rolls inwards. It's 10% effort. It's hardly at all. Keep this really, really light. So roll that hip inwards, 10% effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Letting that go. And then resting. And repeating that 1 to 3 times. Resting. And one more time, rolling that right hip medially for 10% effort for 10 seconds. 10% effort is the weight of a dime. It's nothing. It's very, very light. So even imagination is good. If any of this targets any or stimulates any back pain, hip pain, knee pain, lighten it up. Chances are we've gone too much effort, and that is always contraindicated. We don't do anything that is uncomfortable. So it's working very differently than a lot of us are used to. So let's do the other side. Medially, 10% effort, rolls inwards, 10 seconds, letting it go. Repeating that 1 to 3 times. And then the hips also roll outwards. So it's better to be felt, I don't know, from the sides, imagining, if you must, that hip rolling back into the hand, not the hand into the hip. Letting it go, resting, repeating. Good, and the other side. So those are all very common reasons that people have back pain. Their quads are tight, their inner legs are tight. If the inner legs are tight and the hamstrings are tight, I have a great cheat to stretch both of them at the same time. I would just go booty against the wall, legs straight up the wall, and then allow your legs to go out, stay on the wall. I was just avoiding the fireplace there. But just where they comfortably go. And if this is all they go, I would say that's definitely some restriction. So you want it to be comfortable, not heaving or wincing or anything. It should feel really good. And if they are tight, if they don't go very far, guess what? We just hang out here and this is your stretch. You don't have to do a whole lot here. You can add a muscle energy technique by doing the same thing, actively engaging inwards, 10% effort, 10 seconds, letting it go, and then allowing the legs to soften if they do. And repeating that 1 to 3 times. Adding inwards, holding, relaxing, and maybe the legs lower a smidge more. Repeating it, sticking to what is comfortable. So don't let the legs and the inner legs be uncomfortable at all here. Cool. When you're coming up, you're going to notice it's a little bit uncomfortable, so just be slow as you get back up. So I would try all of those recommendations, and if nothing works there, give your favorite osteopathic practitioner a call. Visit myislandmo.com.